A bold and controversial move by the Maharashtra government has sparked fierce opposition from the medical community, allowing homeopaths to prescribe modern medicines after just a brief training course. But here's where it gets really contentious. This decision could fundamentally alter the landscape of healthcare in the state, raising serious questions about patient safety and professional standards. The Indian Medical Association, IMA, has formally urged Chief Minister Devendra Fadnavis to revoke a recent government order that permits homeopathy practitioners to prescribe allopathic medicines upon completing a 6-month certificate course in Modern Pharmacology, CCMP. The IMA has even threatened a statewide strike if their concerns are ignored. On June 30th, the Maharashtra Medical Council, MMC, issued a notification revealing that the state's Medical Education and Drugs Department has authorized the launch of the CCMP specifically for homeopaths, enabling them to practice modern medicine. This move has alarmed many doctors who see it as a dangerous dilution of medical qualifications. In a strongly worded letter, the IMA expressed deep unease and outright objection to the directive instructing the MMC to register homeopathic practitioners who have completed the CCMP. They emphasized that the MBBS degree, which qualifies doctors to practice modern medicine, involves rigorous training over 5.5 years, covering 19 subjects, extensive clinical exposure, and a mandatory internship. In stark contrast, the CCMP is a mere 1-year course with only 2 days of instruction per week, far too limited to equip practitioners with the comprehensive knowledge, clinical skills, and critical decision-making abilities essential for safe medical practice. The IMA warns that this decision jeopardizes the quality and safety of healthcare services. Allowing practitioners with such limited training to treat patients could lead to misdiagnoses, harmful drug reactions, increased antibiotic resistance, and even fatalities, especially in rural areas where healthcare resources are already stretched thin. This isn't the first time Maharashtra has blurred the lines between medical systems. Back in 2014, amendments to the Maharashtra Homeopathic Practitioners Act and the Maharashtra Medical Council Act allowed homeopaths to prescribe certain modern medicines under specific conditions. However, the IMA highlights that this latest step goes much further and raises significant legal and ethical concerns. According to the IMA, the National Medical Commission, NMC, and State Medical Council regulations clearly stipulate that licenses to practice modern medicine must be granted only to those holding an MBBS degree. The CCMP, being an orientation course rather than a full medical degree, does not meet these legal standards. Granting licenses based on this course could be legally questionable and undermine the regulatory framework. Moreover, the IMA warns that recognizing CCMP qualified homeopaths as modern medicine practitioners could open the floodgates for other alternative medicine practitioners to demand similar recognition. This could create chaos within the healthcare system, erode public trust, and blur the lines between distinct medical disciplines. Another critical point raised is the potential damage to Maharashtra's reputation on the international stage. Registering CCMP doctors might compromise the credibility of the state's medical education and healthcare services, affecting collaborations, research, and patient confidence globally. The Doctors Association concluded their appeal by reminding the government that healthcare is a sacred responsibility and urged immediate reconsideration to protect the health of Maharashtra's citizens and uphold the integrity of the medical profession. They specifically requested the withdrawal of the government resolution dated September 5, 2025. Should the government fail to act, the IMA has announced plans to escalate their protest, including a 1-day statewide token strike on September 18, 2025, during which all healthcare services would shut down for 24 hours. Adding to the legal battle, the IMA has challenged the amendments in the Bombay High Court and insists that no new policies be implemented until the court delivers its verdict. This situation raises a provocative question. Should alternative medicine practitioners be allowed to cross over into modern medicine with minimal training? Or does this risk undermining patient safety and professional standards? What do you think? Are these reforms a necessary step toward integrated healthcare, or a dangerous precedent that could compromise medical care? Share your thoughts and join the debate below.